All right, let's switch now into Amplia Therapeutics, a listed drug development company focused on the clinical development of two highly promising drug candidates that were originally discovered by the Australian-based Cancer Therapeutics Cooperative Research Centre. Well, Chief Executive, Managing Director and Co-founder, Dr. Chris Burns, joins us now. Chris, very good to catch up with you. Thanks for joining us. So you've come up with the development of two promising drug candidates to treat focal adhesion kinase. Is that right? Just tell us what that is.
Indeed, yes. So focal adhesion kinase, or FAK as we call it, is a protein that's overexpressed in a range of cancers such as pancreatic cancer and ovarian cancer. But it's also involved in formation of fibrotic scar-like tissue in not only cancer but also diseases, so like idiopathic pulmonary fibrosis, kidney disease and the like.
All right, so where are you at just in terms of the development of those drugs then?
Yeah, so our lead drug's called namafotinib, but that drug is currently in the clinic. So we've just announced a couple of weeks ago the completion of a dose escalation phase of namafotinib in advanced pancreatic patients. So these patients have got advanced pancreatic cancer, and they're normally treated with a mixture of two drugs called gemcitabine Abraxane. And what we do in our trial, we add on top AMP945 to that gemcitabine Abraxane chemotherapy combination. And what we saw in that dose escalation phase is that the drug was safe and well tolerated. We saw some preliminary signs of efficacy, which we are really pleased with, compared to historical norms for gemcitabine and Abraxane alone. And we've identified a dose that we can now take into a dose expansion phase, the phase 2 portion of that trial, which will start shortly.
All right, so you're saying also potentially therapeutic target there in fibrosis, as you mentioned. Just as far as treatment there as with pancreatic cancer, how does the potential of this drug compare with what's already available?
So the current treatments of pancreatic cancer are not very good, to be blunt. The 5-year survival for pancreatic cancer patients, advanced patients, is somewhere around 10%. In other words, if you're diagnosed with pancreatic cancer, you have a pretty low chance of reaching making 5 years. The drugs themselves are cytotoxic, so they're quite difficult for patients who are already unwell with their disease are then getting additional chemotherapies that actually affect their quality of life. So our drug is an addition to that chemotherapy that is shown to be safe and well tolerated and actually makes the chemotherapy work better. So we hope that that our data, the preliminary data we've seen today, will pan out in the phase 2 trial and lead to better patient outcomes, an extension of life, and some reduced toxicity. But look, that all remains to be seen in the expanded patient cohort.
So, Chris, what's the timeline then in terms of these trials?
Yeah, good question. So we're currently just tooling up to start the phase 2 trial, which will start very shortly in the next couple of weeks. We will run that at 7 sites in Australia, so in Melbourne, Sydney and Brisbane. We're bringing on 5 sites in South Korea, which have a very excellent clinical trial capability, high number of pancreatic cancer patients, and they use the same treatment as we do, gemcitabine Abraxane. And we'll be looking to recruit initially 26 patients and treat them with our drug. And then by mid-year, we expect to have some interim data that we can then determine whether we continue with the trial or whether we fine-tune the trial further. So that's mid-year 2024. We'll have interim data on the efficacy of our drug in combination with gemcitabine and Abraxane. So,
of course, the trials require funding. How is your funding looking at the moment?
So we announced in our 4C in end of September that we've got $5.7 million in the bank. That's definitely enough for us to continue with the trial. Obviously, we would like and need more money as we get into the deeper part of the phase 2 trial. But we're well set up at the moment, and we're excited about the opportunities, not only in pancreatic cancer. We've also recently announced to the market some really promising data in ovarian cancer. This is preclinical data, so data in various models. And that's an exciting area as well, because ovarian cancer is also a fibrotic cancer like pancreatic cancer. And one of our competitor companies, a US company, recently announced promising clinical data of their FAK inhibitor in ovarian cancer. And we believe our compound works better than that competitive compound. So there's, if you like, clinical validation of FAK inhibition of this particular protein target in fibrotic tumours. So we feel that the opportunities are really very good for the company.
So that's in the preclinical stage, is it? What's the timeline?
Yeah, so that's so it's the same drug. The studies we've done in ovarian cancer have been in a preclinical sense. So we're talking to clinicians both here in Australia and in the US about opportunities to open a clinical trial in ovarian cancer as well as pancreatic cancer. But that won't happen till sometime in the new year.
Chris, we wish you well. I look forward to following your progress. Thanks so much for joining us from Amplia Therapeutics.
Thank you very much.